I'm Paul Van Binder, the Chairman of the Immunisation Coalition and a public health physician on the Gold Coast. I've just finished following up the contacts of a child with brain abscesses who was suffering from meningococcal disease. And last week, the news reports came out of regional Victoria about a university student who passed away from meningococcal disease. Meningococcal disease is an uncommon but incredibly serious disease. Around about 1 in 10 children can pass away from meningococcal disease. It's a very rapidly progressing disease. Children can be well in the morning and incredibly sick late in the afternoon. Many parents will have seen photos of children without limbs who are suffering meningococcal disease consequences, and there are other consequences. Children become deaf after meningococcal disease and have neurological deficits. And what's even more worrying is that a new strain of meningococcal disease has just arrived in Australia over the last year or two. We saw this in countries like Brazil and England, where the death rate actually increased to around 1 in 4 people. And we know that we need to take steps now to try and prevent that disease taking a hold in our country. Happily, we have a very good and very safe vaccine against the new types of meningococcal disease. This vaccine can do 2 things. It can help protect your children from meningococcal disease, but it can also help clear the carriage. Many children harbour this bacterium in their throat, and although they don't become sick, they're capable of transmitting it to other children. If we have a vaccine program for those children that are most likely to carry it, we may be able to help eliminate this meningococcus from Australia. Because of this, a number of states have now introduced a vaccine program for late teenagers to try and protect them and rid our country of this bacterium. We know that in the past, when we have conducted campaigns to protect adolescents, late teenagers, we've had appalling coverage rates. These are not a group that put their hand up and say, I'm going to go to a general practitioner to get vaccinated. We need their parents to make sure that their children are protected. On the Gold Coast, we are running a mixed program. All children in Year 10 will be offered vaccine through the school program. Please fill out the electronic consent form and return it to Public Health so that we can make sure your child is vaccinated at the school. If your child misses vaccine at the school, if your child is outside the school age range but is between the ages of 15 and 19, please attend your general practitioner after first checking they have vaccine, or please visit one of the mass public clinics being organised by the Public Health Unit. These are available on the internet by searching Immunise GC to look at the clinic sites and times. Thank you.